Hello and welcome to the ID Talk podcast. My name is Peter Cantor and I am the editor-in-chief of FindBiometrics and Mobile ID World, where we have recently placed a major focus on strong identity technologies and healthcare applications. That, once again, is the topic of today's mini-episode, which is a follow-up to my conversation with HID's Jeff Carpenter on how biometrics change healthcare spaces for the better. In this episode, I'm joined by Sheila Loy, Director of Healthcare Segment Strategies at HID Global. We talk about how patients use biometrics for authentication at clinics and the challenges of electronic health records in the era of the data breach, before exploring some of the ways HID Global is serving healthcare professionals like doctors, clinicians, and lab workers when it comes to authentication. It's a great add-on to ID Talk's conversation with Jeff Carpenter, and can also serve as a great entry point to that longer interview as well, which I'll include in the show notes. So without further ado, here's HID's Sheila Loy on the ID Talk podcast. I'm joined today by Sheila Loy, Director of Healthcare Segment Strategies at HID Global. Sheila, thank you for joining me today on ID Talk.
Thanks for having me.
So let's talk about healthcare and identity. I recently spoke to your colleague, Jeff Carpenter, about the topic, and it's really amazing how broad the range of applications are for biometrics in this sector. To start off, how are patients using biometrics for authentication at clinics?
Well, I think, as Jeff mentioned, it is a little scenario dependent, but the patients, we're seeing a lot more patient interaction with biometrics simply because of the positive identification of biometric brings. One of the pain points, as I'm sure you're aware, Peter, is that sometimes the wrong record gets launched to the patient's visit, and that's expensive and time consuming to correct on the healthcare organization side. So if you use a biometric when you come in and check in for your appointment, you are getting that one-to-one match with the actual record that should be yours. So that's the benefit on the healthcare provider side. From the patient perspective, if you are going in for an appointment to see several different people, you say name, date of birth, and all of these types of identifiers over and over again. And so it's a clean, slick, easy user experience for the patient as well to identify with the biometric.
Yeah, it's definitely in that convenience and security combination that we always look for here in the biometrics industry. You mentioned patient records. We live in a time of major digitization, but also we're living in the era of the data breach. Mm-hmm. That puts patient records in a precarious situation. Right. What is HID doing in the healthcare record space?
Well, I'm going to answer that question in a very similar frame. From a clinician's perspective, getting in and out of the right records so that you are seeing them, no one else is seeing them, they're not left open, is a challenge. A lot of organizations still type in username and password thousands of times a day. And you can use your credentials and you can use your biometrics to gain access into the EMR patient records within a clinical setting. So that's secure and private and compliant, and it short tracks, the continuous verification of that clinical worker. From a patient perspective, one of the trends we're seeing is making sure that they too have the option to get into the patient portal to their own medical records using authentication. So the patients are getting smarter to the world of hackers, and they want the secondary factor. And oftentimes it can be that biometric, maybe on their mobile phone or facial with a fingerprint, or other means of authenticating. But the patient also needs to take that extra step to assure their privacy of their medical data.
Clinicians need immediate access to data and applications from any workstation at any time. Efficient security measures create more time with patients, higher quality care, and more satisfaction among staff. HID Digital Persona is used by clinics and hospitals for secure, compliant, and rapid authentication of medical providers and back office staff into critical applications, workstations, and networks. By leveraging your existing infrastructure, Digital Persona's technology integrates seamlessly with your most complex environments to accommodate and support operating system platforms. With HID Digital Persona, you can eliminate common and shared passwords, use secure authentication for PCs and shared kiosks, and simplify application access with single sign-on, giving you time to focus on patient care. To learn more about delivering a connected, secure, and efficient healthcare ecosystem, visit hidglobal.com/IAM. And now, back to the podcast. Now, we've been speaking quite a bit about patients, but of course, healthcare is more than patients and their data. Hospitals, clinics, labs, especially right now, quarantine facilities, these are all high-risk workplaces for professionals. How does HID serve medical staff, clinicians, and lab workers when it comes to identity and authentication?
Well, it's not easy. And as Jeff Carpenter mentioned in his longer podcast, the average is 2.5 authentication method choices for every physician or clinician. And again, they're scenario dependent. You might be in your own office within the hospital. You might be in a clinic across town. You might be at a conference. You still need access to get into the EMR system itself to continue your day job. Maybe it's prescribing narcotic prescriptions, and you need those. There's very compliant levels of authentication for EPCS. So regarding any type of authenticator, it's important. Compliant authentication is uber important, but the ability to use a biometric is certainly a trend that's catching on because of the one-to-one match and the ease of use. So we feel that it's important that whether you are in any of those environments, that you use an appropriate means of authenticating yourself to get into the digital spaces and, quite frankly, the physical spaces if you are in a facility where you're supposed to be.
And for anybody who is interested in learning more about this, how can they get in contact with you and HID Global?
You can visit our website at hidglobal.com/healthcare. You'll find more use cases and how HID serves that community in one easy place on our website.
Fantastic. Well, Sheila, thank you again for taking the time to talk to me today, and I hope to talk to you again soon. Thanks for joining me on ID Talk.
Thank you very much.
And so concludes my conversation with Sheila Loy, Director of Healthcare Segment Strategies at HID Global. Learn more about the topics we discussed in this interview by listening to the recent ID Talk episode titled HID Global's Jeff Carpenter on How Biometrics Can Transform Healthcare for the Better, available on Apple Podcasts, Stitcher, and SoundCloud, and linked in this episode's show notes. I'd like to thank Sheila once again for joining me on today's episode. Our podcast theme music is by Logomrad. My name is Peter Counter. Thank you for listening to the ID Talk podcast.